My name is Alfredo Bautista, and I am an associate professor in the Department of ECE. I am also associate head of the Department for Internationalization, together with my colleague, Dr. Ching, who you will be meeting later. We are, both of us are very excited that so many international colleagues around the world are joining us for this seminar today. This seminar, which we call Interconversations. Interconversations is a series of online seminars that our internationalization team has been organizing so that the international early childhood education community continues to feel connected, especially during the pandemic, these pandemic times. This is actually our fifth Interconversations seminar today. The title of today's session, as you can see on the poster on the screen, is Myths About Preschool Children with Special Needs, Wisdom and Tips from Around the World. So let me just give you a little bit of a background for the session. So as you know, the term special education needs, or SEN in short, refers to children with learning problems, difficulties, or disabilities that make it harder for them to learn as compared to most children of the same age. In recent years, more and more children with special education needs are being integrated and included in mainstream schools, despite general education teachers having actually limited training and often also very little experience working with SEN children. So this change of education policies towards inclusive education, coupled with a lack of parallel increase in teacher training and also in school manpower, has largely increased the workload for teachers, right? And this is a problem that is occurring all around the world. So the move towards inclusive education and embracing children with special education needs is a very noble one, is a very noble effort, as it is helping societies to become a more just and fair societies. However, at the same time, we also need to educate teachers about inclusive education and provide them with the knowledge and with skills to teach in classrooms with diverse needs. So this is actually part of the justification for the session today. So for this seminar today, Sanjin and I invited, as you know, a researcher and then also several practitioners from different countries who have experience working with diverse groups of children with special needs, to share with us experiences, tips, and strategies that hopefully will be helpful for educators, especially at the preschool education level, right? So the plan today is to have very short presentations by them, followed by a discussion, some questions and answers in a large group, to be able to exchange some perspectives and learn from one another. So we really, really hope that you will enjoy the session today. Now, the head of our Early Childhood Education Department, Professor Kerry Lee, would like to welcome you to this Interconversation seminar with a very brief welcome address, right? So Professor Kerry Lee, the floor is yours now. Thank you.
Thank you, Alfredo. Hi, everyone. I'm Kerry. I'm head of the department. And on behalf of the department, I would like to welcome all of you to today's forum. We are honored to have so many of you with us from all around the world. Our department was established in 1994. It's one of the leading ECE teacher training and research departments in Hong Kong, indeed in the region. We have around 60 full-time academic staff, around 2,500 students, and we offer a range of programs at different levels, from diploma, high diploma, bachelor to master, and indeed at the doctorate level. Now today in the audience, what we all have in common is a desire to better understand children with special needs and then how we can improve education for them. It is this care and concern for children and a desire for a world that can accommodate all people regardless of the disabilities and differences that bring us here today. I want to thank all the speakers and the organizing committee for making this forum happen. And I hope you will find the forum enriching and provides the needed stimulation for achieving greater heights. Thank you.
Thank you very much, Kerry. So now we are going to have our colleague, Dr. Sanjin, my colleague in the department, also associate head of department, who is going to tell us a little bit about the participants for the session. Sanjin, you're going to go ahead?
Hi. Thank you, Alfredo. And hello, everyone. I'm Sanjin. I'm also associate head for internationalization in the EC department. We hope that you and your family are healthy and coping well in this really difficult times. For today's session, we actually have around 400 participants registered for today's session. And many of them are from Hong Kong and mainland China. And also we have registrations from our neighboring countries. So many thanks everyone for your interest. And it's so great to meet you virtually and to establish this connection with you.
Great, thank you so much, Sanjin. Great, so let me share a little bit with you about the structure for the session today. So the whole session, if everything goes well, will take around 1.5 hours. So first, we will have the presentation by a researcher on special education policy, who will be sharing with us about inclusive education and also a little bit about several important aspects that early childhood educators need to be aware of when working with children with special needs. Then we will have the sharing by SEN practitioners from different countries. Like I said, four practitioners who have experience working with children with different types of education needs. One of the questions that we asked them for discussion, as we will explain later, was what are some of the most common myths about this specific group of children? So the invited practitioners will be talking about it. And also they will be sharing some tips and different strategies that hopefully will be helpful for educators at the preschool level when we work with these children. The plan is to have, as I mentioned before, short presentations and then have a discussion by the end, have the opportunity to ask questions and to learn from one another. And then we will close the event. So this is pretty much how we are structuring this session. So let me share with you the wonderful panel of speakers today. As you can see on the screen, so first we will have the sharing of Dr. Eva Lai, who is our colleague, assistant professor of teaching in our ECE department. And she will be dispelling some of the most common myths of inclusive education in the field. Then we will have, as I said, 4 practitioners with ample experience in working with children with special education needs, who have kindly agreed to share their knowledge and their experience with us. As you can see on the screen, first we will have Mr. Kingman Chung from Hong Kong. Then we will have Ms. Chen Yuwei from Mainland China, followed by Ms. Sarah Brunton from Australia, and finally, a good friend from Singapore, Dr. Malathy Krishnasamy. So this is our panel of speakers for the session today, right? So let's move on to the first speaker of the day. Our first speaker, as I said, is Dr. Eva Lai, who works as an assistant professor of teaching here at the Department of Early Childhood Education at EDU Hong Kong. Hi, Eva, I can see you here. So let me share a little bit about her with you. So Dr. Eva Lai received her Bachelor of Philosophy in Special Education in the UK. And then she obtained her MEd in Early Childhood Education and her PhD in Australia. She has extensive experience in teacher education, early childhood education, and early childhood special education. Eva is interested in inclusive education and policy, early childhood special education, and also picture book reading and teaching. And she has published extensively a number of journal articles, book chapters, and conference papers on these topics. So Eva, thank you so much for being here with us today. So please go ahead and you can go ahead and share your screen and the floor is yours. Thanks very much.
Thank you. Hello. Thank you so much, especially to Dr. Bautista, Dr. Sun, Professor Lee, and also the ECE department for inviting me to give a talk to everybody. I am really happy and thankful to have this opportunity to share my views with all of you here. Today, the topic is on the myths of inclusive early childhood education. When talking about inclusive education, we know that this policy has been operated in every corner of the world. However, different places also have different policy to implement inclusive education. So before I start my talk, I would like to let you know what does inclusive education, i.e. in short, mean. According to the UNESCO, inclusive education is to allow all children to learn and also learn to live together in regular classroom so as to recognize and respond to the diverse needs such as disabilities, gender, and social class of students and ensure quality education for all through appropriate curricular, effective teaching strategies and resources used, as well as collaboration with parents, school, and communities. The goals of inclusive education helps students with diverse needs overcome barriers that limit their participation and achievement in general education system. Okay, let's see. IE has developed worldwide through global concern and commitment. However, myths of inclusive education, in particular, the inclusive practice for children with disabilities, continue to weigh with creates barriers to inclusive education. Therefore, I will focus on how to dispel the myths of inclusive early childhood education that we have commonly heard about children with diverse needs, especially those with disability. Okay, let's see the first myth. Only wealthy country can implement inclusive education. Actually, the implementation of IE from preschool to secondary school is a fair option because IE advocates human rights, equity, anti-discrimination, and equal opportunity for all. So when preschool embrace inclusive education as a whole school reform effort, all children, including those with disability, will have equal access to the broad range of facilities and have active participation in all activities in regular preschool. So all countries in the world would operate IE. Then the second one is inclusive education has a negative impact on children without disability. In reality, inclusive education not only promotes the holistic development of children with disability, but also offer benefits to children without disability by, for example, enhancing their social and communication skill and also be more aware of the needs of others. However, these benefits only exist if preschool truly implement inclusive practice, then the learning environment where inclusive education is operated can meet the needs of each child, and every child will have an opportunity to succeed. Let's go to the third one, which is about inclusive education affects student enrollment and the repetition of the preschool. This myth indicates that some resistance to the inclusion on children with disability in regular classroom still exists. This resistance is explained in terms of pervasive elitism arising from the society. To help these children to be accepted in regular preschool, the service provider such as the inclusive preschool must promote inclusion as an issue of social change that involves the modification of values, attitude, belief, or institution of society for his benefit. In addition, people in the society need to understand that the ultimate goal of the ECE policy is to promote the holistic development of all children, including those with disability. So the elitism should be minimized. Also, when preschool embrace an inclusive education as a whole school reform effort, for example, a loving and caring classroom atmosphere has to be provided, and the curriculum contents should address the core features and characteristics of children with diverse needs. This helps people in the society believe that inclusive education promotes educational equity and quality for all. Then parents with children with typical development will not reject their children to be admitted into inclusive preschool. Let's move on to the next. Inclusive education overloads general education teachers. Actually, an inclusive education model is only making a paradigm shift from general education system to an inclusive practice. Some teachers consider that the paradigm shift in education is challenging. However, once preschool truly implement inclusive practice, the teaching requirements of inclusive education should be the same as that of general education. And this will not give general education teachers more work than they can deal with. Because successful inclusive education relies on the collaboration among general and special education teachers and professionals, such as therapists, psychologists, and social workers. Let's move on the fifth one. Not every child with a disability is suited for inclusive education. Actually, this myth is built on the belief that children with disability, especially for those with intellectual disability, are not welcome and allowed to be in inclusive education. The assumption underlying this myth is that some people continue to have a long-standing dismissive attitude towards children with intellectual disability and their potential. However, when the whole school approach to inclusion is truly operated, this helps teachers improve and promote the quality of education for all. This also helps children with intellectual disability in inclusive classroom achieve improvement in areas such as communication, social, and cognitive skill. Therefore, children with intellectual disability are also suited for inclusive education. Let's move on to the last one. Some general education teachers have inadequate skill to teach children with disability. With few exceptions, ECE teachers are trained as generalists. Most of them also study maybe 1 to 2 courses on special education when they study the professional diploma or degrees. However, they believe that if they are required to deal with children with disability in regular classroom, they should be well trained or need instruction provided by special education teachers. However, this situation may be also true for special education teachers who are specialist teachers. Why? Because each practitioner and even professionals in inclusive educational setting have their set of strengths and weaknesses. Therefore, when the effort of whole school reform is made, collaboration with other teachers or professionals in inclusive preschool can complement each other's skill and lead to student success in development and learning. As I mentioned earlier, different places have different policy for implementing inclusive education. As I have also emphasized several times in my previous session, when the effort of whole school reform is made, inclusive education can lead to success in learning and development of all children, including those with disabilities. But it is actually, the whole school approach to inclusion is not a new concept, but it is a new necessity for implementation in general education settings. So I would suggest to adopt the whole school approach to inclusion as a whole school approach is school-based enhancement program to improve the program quality, thereby establishing a positive inclusion school culture. Actually, you can see the components of the whole school approach in this PowerPoint slide. The whole school approach is about the inclusive preschool to develop a positive school culture to embrace all children with diverse needs, including those with disability. School culture can can be used to include all the attitudes, expected behaviors, and values that impact how the school operates, such as the implementation of inclusive education. Also manage and implement a good quality inclusive policy and practice, such as the modification of mainstream curriculum, the use of flexible assessment strategies, the adaptation of different instructional pedagogies, such as play-based activities, and special teaching techniques, such as assistive technology, and also the enhancement of child-child interaction, home, school, and community collaboration, and also the recognition of inclusive preschool as part of society and utilization of social resources. Before ending my talk, I would say that to dispel the myths of inclusive education for children, especially for those with disability, both educational and social change on inclusion must be promoted in addition to adopting the implementation of whole school approach to inclusion in regular preschool. That is, the service providers must ensure that all children in inclusive preschool can fully benefit from the educational environment. The public should also respect the rights of all children to obtain educational benefit from their day-to-day lives. Therefore, responsibility of school stakeholders and parents and people in every society, including you and me, is to ensure that all children with diverse needs in inclusive preschool grow up healthy and happy. Thank you, everyone.
Thank you so much, Eva, for your very clear presentation about and rigorous about the different myths. As you were presenting, we had a few colleagues typing their comments and questions on the chat. So I was just saying, keep the questions coming and comment and keep them coming, because after all of the 4 presentations, we will have the time for questions and answers. So we will just keep them there for a little while. So let's move on to the sharing of the invited practitioners now. So to give you some context first, we are going to start now with the sharing. So these practitioners have been invited to give a 5-minute presentation. So everything is very short. So when we contacted them in the beginning, so we gave them 4 prompts to guide them in their presentations, as you can see on the screen. So number 1, we said, please briefly introduce yourself and tell us which group of children with special education need you work with the most. The second one was, what are the most common misunderstandings about this group of children? Number 3 was, what do you wish early childhood education practitioners knew about this group of children? And finally, we said, what are some practical things or strategies that you can do to improve the classroom experience for this specific group of children? So each presenter, as I said, was given a limited time to present, just only around 5 minutes. So given that the time is actually very, very short, we propose that we save all the questions, as I said, for the time later on for questions and answers, right? So let's go for the first practitioner, who is going to be introduced by Sanjin. Sanjin, go ahead, please.
Okay, thank you, Alfredo. Our second speaker today is Mr. Kingman Chung. He's from Hong Kong. Kingman founded the International Music Therapy Center in 2013. This is the first social enterprise in Hong Kong dedicated to the promotion of music therapy. Kingman completed his Master of Music Therapy at the University of Queensland, and he's a registered music therapist. He provides therapy sessions, workshops, and trainings at hospitals, universities, and NGOs, focusing on serving people with special education needs, cancer patients, stroke survivors, and their families. He's a clinical tutor of the University of Melbourne and honorary advisor of the Cancer Info Charity Foundation. Kingman received over 100 media coverage for his work, and recently he received the Smart Living Award 2021 for Outstanding Innovative Music Mental Wellness APP. Kingman, please go ahead and share your screen. The floor is yours now.
And good afternoon, everyone. And this is Kingman, and thanks for having me today. And so I can skip the first slide because you have to introduce me. And so here are some pictures of me working with my students with ASD, physical disabilities. Some of them, they are diagnosed in ADHD, cerebral palsy at a special school from 3 years old to 20 years old. So after music therapy assessment, we often do song singing, music and movement, improvisations, and songwriting during the sessions to address emotional, cognitive, motor, social, and communication needs. So I'm going to show you a video of a part of music therapy sessions for kids with special needs by music therapist Sarah Jane from the Live Rhythm Music.
Oh, good stopping. Ready? Let's go! Can you shake up?
So what is the magic of music therapy? So how does it work, and why do the kids actively participate in music therapy sessions? So there's a lot of teachers and also parents ask me about why the kids perform differently in the music therapy sessions. So let's look at how the Australian Music Therapy Association defined music therapy. Music therapy is a research-based practice and professions in which music is used to actively support people as they strive to improve their health and functioning and well-being. And there are 5 reasons why music works very well for SEN students. Firstly, music creates bonding. So every time when we start the sessions, we will sing a hello song. So hello song like this. So hello Jaden, hello Jaden, hello Jaden, and how are you today? So the songs can not only enhance the social skill, but also build up the engagement and the therapeutic relationship with the students. And second, music is structured. So most people with autism love competing things perfectly. So when we sing ABC songs, so A, B, C, D, E, F, G, you want to complete the whole structure of the song. H, I, J, K, L, M, O, P, Q, R, S, T, U, V, W, X, Y, and Z. Now I know my ABC. Next time, won't you say with me? Yeah. So the songs, the music is structured. So especially for students with autism, they would like to complete it perfectly because they feel uncomfortable if the song is not completed it well. And thirdly, music provides a multi-sensory experience. So their tactile system is engaged when they are feeling the magnet bending the drum in their hand, so they can feel it. The kinetic system is engaged because they move their arm to bend the drum. The auditory system is engaged because they start listening to the sounds of the drum. And the visual system is engaged because their eyes track the motions of their arms and the mallet bending on in their hands. So so music provides a multisensory experience for our students. And furthermore, music is nonverbal. So it provides a safe and containing environment for students to express themselves and communicate with others. Last but not the least, music stimulates our whole brain. So when we are making music, the sensory cortex, the auditory cortex, the hippocampus, visual cortex, cerebellum, amygdala, prefrontal cortex, and motor cortex are all light up at once. So for example, kids naturally move their body when the music starts, as the music stimulating the motor system in our brain. So what we call it music trial. So music trial, everyone has music trial. When a kid just born, or even now we are adults or elderly, we have music trial inside our heart. So music therapy is not a magic, but is a research and evidence-based therapy interventions to our SENS students. And there are some tips for our teachers and for work within in the classroom. So first, you can try to integrating music into your classroom. So by using live or recorded music for greeting songs, so hello song, goodbye songs, or we can do some body warm up, so movement warm up for them to draw their attention to play in the class. And also we can use the songs for them to understand the different emotions. Sometimes we're using their favorite songs as a reward, and of course we use music for fun. And also as a music therapist, I always put this into my last slides. Try to consult qualified music therapists in your countries, because you will find more suitable activities tailored for your classroom. Thank you.
Thank you. Thank you so much, Kingman. Your presentation is so much engaging, and I like your songs a lot. So thank you very much. Now let's welcome the third speaker of our today's session, who is Ms. Chen Yuwei from China. Yuwei founded the EM Behavior Services in Chengdu, China, where she pioneered a model classroom that serves children with autism. Yuwei studied and earned her bachelor's degree in psychological sciences in Singapore. She is now a master's student at the Department of Special Education and Counseling at the Education University of Hong Kong. Yuwei is also taking courses and completing her supervision hours to earn her board-certified behavior analyst certificate. She was selected to represent the Teachers Training Program for Children with Autism, co-founded by the China Disabled Persons Federation and the Southeast Asia Prior Center. Yuwei's passion is to teach, learn, and translate applied behavior analysis into practice. So Yuwei, the time is yours. Please go ahead and share your screen.
Hi guys. Hello. So I'm Yuwei from China. Currently, I'm working towards my board certified behavior analyst certification, and I'm also a student in EDU HK and in the area of special needs education. Yeah, and I'm the founder of EM Behavior Services. We serve the kids with autism and developmentally delayed from 2 to 6 years old. And we provide applied behavior analyst-based services for all these kids. So here are some misunderstanding, like here are some misunderstanding about children with autism in China. So there is 1 in every 100 children in China diagnosed with autism. Although efforts are currently underway to determine the prevalence of autism in China, to date, there are no reliable data that indicate magnitude of the problems. So there are no exactly data say how many children are diagnosed with autism in China. So there is still the lack of awareness in China. And autism is sometimes called lonely disease in Chinese, which has led to public misunderstanding of autism. So most of people will think autism is a family issue, maybe because the parents do not give much attention or much care and love for children. That's why they are autism. So many Chinese families think that way. So they think without intervention, if they can give more time, attention for their kids will getting better in the future, like later on. But that's not the truth. So as for autism, it's a mental health disorder. The earlier intervention, the greater likelihood of success will be in their life. And in China, most institutions that provide care and intervention for children with autism still lack of professional support. Here are some photos took in 2018 and 2019. I was selected to a teacher training program for children with autism in Pittsburgh Behavior Services in Penn State. So after these two interns in Pittsburgh, I was trained and practiced with ABA method, applied behavior analyst method, and it's an awesome team. They really do teach me how to deliver ABA method, like how to set up ABA based classroom. You can see from the picture, like this, like the table setting and the reinforcers should be in the boxes, and they also have some work crew for teachers and the table settings. So after my interns from States went back to China, I set up my own centers. So we have our own data system, ABA-based data system for each children, and we have our car source system, as you can see from the table. And we have the ABA-based classroom organized, and we provide the children with autism intensive teachings. We do help them to shape their verbal and nonverbal abilities by vocal shaping and like ABA method. So here is our data system. So you can see we have like skill tracking sheet, graph that we track each day of children's behaviors, like teach them how to tag the object, and we graph them. So we don't teach kids, we don't really have fun time with kids, honestly. So our teaching is very intensive on the table. So we set up each goal for the children, like listener response, tag, interverbal, motor imitation. We set up each goals and we track each target, and we graph them slowly. Like we can really see the progress of the student by all these graphs. So what can early educator do to help this group of students with autism? So I think efforts can be made to increase awareness of autism and improve the identification of autism by the community and facilitate the early diagnosis of children with autism. And I'm highly recommending the evidence-based interventions for children with autism, because it's one of the most effective intervention for early diagnosis of for early autism, children with autism. And I also encourage parents to seek early diagnosis of autism and developmental disability at the hospital. And as for the early childhood educator, I think you guys can really educate the parents about some evidence-based interventions, such as behavioral intervention. And I do believe multidisciplinary collaboration is very helpful for the children with autism, which means music therapy, speech therapy, BCBA, and psychologists, school teachers, and early childhood educators. All of us can work together to help the children with autism, to help them really achieve the multiple goals in their life, to really make their life better. Yep. So early childhood educator, I think you guys typically refer to the teaching of children between infancy and kindergarten age. These are some of the most important years of a children's life. So you guys have played an incredible, important role in life of these children. So like I encourage you guys like really to know more about children with special needs. Yep, that's the end of my presentation. Thank you very much.
Thank you, Yuwei, for your wonderful presentation, and the data evidence-based approach applied in your center is very impressive. So now let's welcome our fourth speaker today, who is Miss Sarah Brunton from Australia. Sarah has worked in special education for over 10 years. She is currently a learning intervention specialist at the Oral School for the Deaf and the Deafblind in Victoria, Australia. She has a postgraduate degree in early childhood education and a master's degree in learning intervention and deaf education. Sarah is currently part of a research project that investigates play and language development in deaf and hard of hearing children. She is a strong advocate for child's right to play, learn, and grow in language-rich, authentic, and developmental appropriate environments where their voices and unique perspectives are heard, seen, and celebrated. Sarah is passionate about fostering strong community, family partnerships, and equitable education for children with diverse needs and abilities. Sarah, you can go ahead and start your sharing.
Here we go. Hi, I'm here to talk about supporting deaf and hard of hearing children in early childhood settings. Before I begin, I first want to ask the question, what is deafness? I think in recent times, we've really started to move away from terms like hearing impaired and bring more of a positive perspective on deafness and what that means, and having a look at education and children with deafness from a child-centered perspective. As early educators, we're going to see lots of different kinds of hearing loss come through our centres, but the most common one that comes through is a sensory neural hearing loss, which means that we might see children with cochlear implants or hearing aids. And these are all interventions that are used to assist hearing loss, but it doesn't actually mean that the children can hear. It's more of an assistance to help us along with accessing speech. So one of the main things that I was asked to talk about today was a myth that I see a lot as an early educator in the deaf space. And the biggest one that I see is that if a child isn't talking, it means that they must be autistic. And this is something that comes up quite a lot in deaf education, because a child with a deafness can also have a lack of eye contact, delayed speech, poor attention, and difficulty interacting with their peers. And a lot of the time when I'm talking with educators in the ECE space, they go, I think they're autistic. But this can be quite different for deafness because there can be other factors involved. With young children who have a deafness, that being an early communicator can be caused by language deprivation. So language deprivation is when a child hasn't had access to a strong foundation of language. And it means that they're not going to be able to develop the social skills that they need to interact, and they're going to have delays in their speech. So in this illustration that I have on this slide, I have an example of a hearing child and a deaf child, and sort of how that language deprivation can be caused. Because if you have a look here, the hearing child and the hearing parent are having this really great interaction. and mum or dad is saying, look, there's a bird, and the child will learn to say, that's a bird, because both of those individuals are sharing the same language. That child is able to hear their parent and they're able to acquire that language. However, on the other side, when we're looking at a hearing parent and a deaf child, the parent has said, look, there's a bird, but their child can't hear them, or they don't have full access to that word or that sound. So that child isn't able to acquire that word. They're not able to acquire meaning, which means there's going to be delays in their speech. There's going to be delays in their understanding of the world, and there's going to be that communication breakdown and the disconnect. And as we all know, the critical period for language development is 0 to 3 years of age. And if children don't acquire a strong language base by 3 years of age, they're really, really going to struggle. Which is why by the age of 3, when these deaf children are entering ECE spaces and we see them in our classrooms, they're already coming with a loss. They're already coming with a deficit because they haven't had access to a full language because of their disability, because of their deafness. So what does that mean for us? What does that mean for us as early educators? What can we do? I'm always going to be an advocate for a whole language approach to supporting children with a deafness. And that means having access to spoken language and having access to signed languages, because that means that that child is going to have every avenue available to them to acquire language. However, the reality is that in our settings, being able to sign a signed language to these children coming in, not everyone is going to be fluent in a sign language. So that's not necessarily realistic for a lot of settings. So I guess my advice or my tip for early educators who may have deaf children in their spaces, there's some really simple things that we can do to provide access, to help these children thrive in their environment. And one of the main ones that I talk a lot about is reducing noise. So the biggest barrier to children that have a deafness is reverberation. And that is when sound bounces around off all the hard, shiny surfaces and makes it really hard for them to hear speech. So if they're going to acquire language, they need to be able to hear us. So this is my setting. This is what the children in my space have access to. And we use things like curtains and mats and cushions, and we put placemats under puzzles to try and really dampen all of that residual sound so that they can really listen in and hear what we are saying, so that they can hear our speech sounds. Because if they can't hear the words, they're not going to be able to acquire the words. They're not going to have that depth of knowledge. And then, like with a lot of other disabilities and a lot of delays, having visuals so that you are providing children that don't have expressive language a mode to communicate with you. So having visual schedules and having things like chat boards or AAC systems around will provide that child with a stepping stone while they are still acquiring their language. And I'm going to leave it there because I've been talking for too long, but thank you so much.
Thank you. Thank you, Zara, for your presentation. And now we will have our fifth and last speaker today, who is Dr. Malathy Krishnasamy from Singapore. Dr. Krishnasamy taught for 15 years as a primary school teacher before she joined the Dyslexia Association of Singapore, where she taught children with dyslexia for 9 years. She also taught a compulsory course on inclusion of children with special needs to trainee teachers at the Nanyang Technological University for some years, before she moved into research and completed her PhD on the quality of life of young adults with intellectual disabilities. Now she is the research lead at the Zai Kwang Kwang Early Intervention for Children, a non-profit organization that runs 4 early intervention centers for children with developmental needs. Her work energized her, but if she wants some downtime, Dr. Krishnasamy turns to reading. Her reading diet includes a large serving of fiction, primarily crime fiction. Dr. Krishnasamy, you can go ahead and share your screen. The floor is yours. Thank you.
Okay, very good afternoon to all of you, and thank you, Dr. Sanjin, for the introduction. As a research lead, I am very fortunate to work on projects with great colleagues and also stakeholders like parents and preschool teachers. So today I will share some insights that I've gained through our project that we do with the preschool teachers, so we can see how they are handling inclusion. So just to give you a background about the different the settings in Singapore for early childhood, we have the mainstream preschools and early intervention centers where I work at. That's one of them. And you can see the class size is really very different. So teachers who handle preschool children, they have a bigger class size, and they may not have kind of support that is present in a early intervention setting. Although the ECDA has announced new initiatives for to enhance inclusion in preschools. So in my own early intervention center, we use the term developmental needs as an umbrella term. Basically, this is referring to children who have delay in whether it's motor issues, physical, sensory, or developmental issues. And because we have about 50% of our children with having autism spectrum disorder, I think the other speakers have also talked about that, but basically this is how it is. They have difficulties with communication. Their interests are rather restrictive. And, you know, like you have this picture of the child here with the 2 cars. They may just want to play with cars and not anything else. And so there is this kind of features that they may exhibit. But I also want to point out that this is along a spectrum. There are some children who show very little signs of ASD, and there are some who have very severe needs. They may be nonverbal and so on. But I also want to point out that it's the same with us, isn't it? We all have needs. We are on a spectrum too in that sense. So we need to think of it in that way, that and try to find similarities between ourselves and the children who we term as having special needs. We all have needs. That's the basic thing that I think is important here. So we talk about creating an inclusive place, school. So I don't want to go through this, it's already been covered, but basically every child needs to feel like they belong in the classroom. Every child needs to feel that they are engaged and they can participate. So what's the most important here is actually the mindset of the teacher. If the teacher is willing to learn and make changes and has an inclusive mindset, then it does help a lot. But you know, earlier I said that we all have needs. Preschool teachers have needs too. So the principals and management have to give support. You have to support teachers so that they can do a good job, right? It's actually the whole school has to work together. And what are the features of a good inclusive classroom? You need to look and see whether the children have access to the curriculum and resources, whether everyone can participate, and whether they have support. Just now, the music class, you saw everyone had a different instrument, but they were all participating. So that kind of thing. So let's imagine that you have a class and the theme for this week is nature, and you have a class of 20 kids and one of them has autism. So you go for a walk and you pick leaves. Maybe he doesn't pick, but you help him to pick, you point out. And then you come back to the class and then you have everyone to do some lesson, they can, some of them will draw, some of them will color, some of them. So there's a range of activities that you provide. Everyone can participate. And you will give materials to have that kind of participation take place. They have access to crayons, markers, paint. Some children whose grip isn't very good, maybe they can use those fat crayons. And some children, they may need more support. Then the teacher or teacher aide can sit next to them. So in a classroom situation, this can happen. If the child with the ASD, for example, he only likes cars, he only wants to draw cars, well, maybe you can encourage him to draw a car and a leaf or a leafy car. So there are ways that you need to encourage and engage the child as well. And how to make your classroom inclusive. It's not just about the lessons. The classroom itself has to be comfortable for everyone. I won't go through the routine and the schedules because I think just now, was it Sarah who did that already? But maybe I can talk about the peace corner or the calm down corner. So sometimes, you know, they say children with children may not be able to regulate their emotions so well. They are very young, and children with autism may have more problems. So you can have a calm down corner where a child can go there to sit quietly, and maybe you have a timer, 5 minutes. That's all they can stay there for, and then you try and see that they're ready to come back, if not another 5 minutes. But the thing is, you don't just put the calm down corner there. You need to introduce the concept to the class, introduce them to all the different activities that is in the calm down corner so they know how to use it. And once everyone understands, and everyone will understand, but it takes time, then you can start going with the calm down corner. So I will stop here, and thank you everyone for your attention.
Thanks so much for your very interesting sharing. So to all of you actually. So at the same time that you guys were presenting, many of you were typing very interesting comments, reflections, etc. So to keep it, given that we don't have a lot of time, what I propose is that Sanjin and I can both select questions and then try to address the question to the most suitable speaker of the day, right? So I'm going to start with the first one, if that's okay. And I think this is a very fundamental question that I would like to address to Eva Lai. So this question was typed around 5:24. So a person in the room, her name is P3D. She wrote something that I think is a very fundamental question that I think many parents sometimes would think. She wrote, all children have the right to be included in a preschool, in a regular preschool. I doubt this. I think this is sometimes it's an idea that really comes from people in society, right? So Eva, I think I think this question was typed at the same time that you were speaking. I think it was addressed to you. What do you think about this comment, this idea that really is quite common in my opinion? Well, how would you respond to a person with this idea?
Actually, this is an ideal thinking that all children should be included in a regular preschool. But I think that it should be seen that how much effort paid by the service provider. I mentioned already that this service providers such as government, preschool, they should, for example, provide funding, and also they need to work with the parents, professionals, and teachers to work on the best service for the children with disability. For example, in Australia, as I know, because I work with a project with teachers in Melbourne, I think that all children, even with severe disability, also learn in a regular classroom. But, you know, of these children with severe disability, the teachers in regular preschool, they have to work with, for example, the inclusive support manager, and also this inclusive support manager can help the children, for example, with severe disability to apply funding to do the treatment. They can, for example, to spend 1 or 2 days to go to the intervention center to learn, and also to receive some treatment in order to minimize their weakness. I think that all children can have the right, but it depends on how much effort the teachers, the parents, and also the communities, as well as the government, to pay. Is this okay?
Yeah, thank you very much, Eva. So, okay, thank you very much. Sanjay, do you want to go ahead with that?
Okay. So I think the second question can go to Kingman, because a lot of our audience highly impressed by the power of music. But here's a very practical question for Kingman, and Ms. Lily Lau mentions that how she was wondering, particular for the first sessions of the achievement sessions, what recommendations will he have to give to the practitioners, because some of the children might not be engaged in the beginning of the treatment. So is there any practical suggestions or recommendations? Mr. Chung?
Yep. Thank you for the questions. I think the main idea and the importance of the therapy session is about the therapeutic relationship with our students. So the first sessions, we are looking at the what is their preference. So what is their favorite music or favorite activity they would like to join into the sessions, and that relationship is very important because it is foundations of building up a relationship, and you can understand more about him or her in the sessions. And especially for, because I saw the questions about the children, the student was deaf, and it's about I have experience working with students with hearing impairment, and I think Sarah can give more comment because she's an expert in this area. But what I do is using the vibrations of the instrument. So when we're banging the drum, so they can't really hear the music, right? But they can feel the vibrations, and the music, the sound wave can communicate and help them to express their feeling. And what we see inside like who have hearing impairment, and they have a very strong intuition inside their heart. So when they walk, they listen to their beat, right? When they look around, it's all about the beat inside their heart. And so we use the beat, use the rhythm to engage with them. And also there's one important thing that I always think in the first place in my sessions is a humanistic approach. We're looking at the strength of the student, but not the weakness. So what they can really do, but not what they can't do. So when we know their strength, we build it up and we help them, and then by the humanistic approach, the weakness will be sort like they can do more things that they expected and out of our expectations. Yeah. Is it all right?
Of course. Thank you so much, Kingman. Very good. As I was reading the comments, some of the comments that I saw as you guys were presenting, there were some reflections about the ratio teacher student, right? So many in the room were like kind of wondering, well, sometimes paying children the attention that they would need would require a higher ratio so that teachers can really pay more attention to them. So there's this one comment for Miss Chen, for Yuwei. So I'm gonna just read the question. So the question came from Nisha, And Nisha said, Miss Chen, I understand the ABA technique for ASD children, but it needs one-on-one teaching and learning, which the SEN specialist helps with. And then she said, educating parents and helping these children is fine, which every teacher does in the classroom, but the ratio of teachers to children in normal classroom make it difficult to support them. So Yuwei, what would you have to say about this whole issue of ratio, and how can we solve the situation, right? So
yeah, so thanks for the question. Honestly, I know it's very hard for the classroom teachers to help the kids with autism. So we don't really randomly put the student with autism into the classroom. So here I want to share assessments. We don't randomly put the student into the classroom. So we need to make sure they have certain level of the language ability, including like all the behavior ability, like their mending skill, play skill, social skill, group skill. So until they reach certain levels. So you can see there are like 3 levels, level 1, level 2, level 3. So this is verbal behavior assessments. So until the children can reach the certain level, we will bring the kids to the inclusive setting. And then our teacher will go with the student to help them to like really help them to get like to socialize in that situation. So we don't recommend the student with autism directly go to the kindergarten. Yeah.
Thank you very much.
That answer your question, because like for the ABA intervention, states recommend BCB, like which recommend us like 40 hours intervention per week. So for children with autism, they really need one-on-one teaching for like that long intensities. So we don't recommend the children with like really worse like symptoms to just bring them in that situation. Yeah.
Thank you, Yuwei. I think we still have around 10 minutes, so we can try ask each speaker some questions. So I think next question we can go for Sarah. So because you mentioned education for deaf children, but as one of our audience mentions that the support for deaf children, the education for deaf children is really limited in Hong Kong. So can you kind of give us some suggestions or recommendations for the teachers as well as parents? I think some of us might be parents of children of special education needs. So can you give us some suggestions for the teachers and also parents who has to face the children with the deaf children?
Hi, yes.
Hi.
Unfortunately, Hong Kong isn't alone in the support that young people with a deafness have. It's quite the same in Australia, that children do not get a lot of support in inclusive settings and mainstream settings, and it's an area of disability that doesn't get a lot of training, and you, on top of having behavioural and communication barriers, educators also, you get a whole lot of technology that you have to wrap your head around as well. So you've got young children with thousands of dollars worth of equipment on their ears that are easily lost and easily thrown. And I think back to what was said before, it's about looking at that child and what that child and that family needs and where they are at. A lot, if you've had a child that has come into your space that wears a device, their family has just given their child major surgery. So that child has gone under a general anaesthetic, an electrode has been implanted into their brain, into their cochlea, which is really traumatic for that family. So I guess it's as early educators, I'm not talking primary school, high school, where, you know, we're dealing with academics, bring it back to that child and that family and where they're at. There is a lot of trauma associated with why they were deaf. Has there been illness? Has there been an injury? And I think that the support that we can offer our families is help them as people to help adjust to having a baby that they thought was going to be one thing and has turned into something else. They're having to work out what their lives look like. Are they learning a sign language on top of their first language? And I think speak with your families, ask them what they need and be there for them and go on that journey with them and ask questions, ask for help. That's my advice, because we don't get a lot of support, but we can always just sit with that with our families because we can be a support for them.
Yeah, sure. Thanks. That makes perfect sense. Alfredo.
Yeah, many thanks. Yeah, so I would like to go with another comment question that was written, which I would like to send it to Mala. So Mala, by the way, I really like when you talk about all of us have needs, all of us are different. So it's important to recognize that everybody, we are all different and need different things, right? So the question I want to pose for you is this one. It was written by Akira Basa. So the question says, thank you for the insightful presentation. I support the idea of inclusion. However, how do we build healthy self-esteem for special needs students if they are in an environment with other students who are more competent? Furthermore, how do we ensure all students can improve through encouragement rather than competition in schools with those learning environments? So especially for a system like Singapore, where academics is quite an issue, same as in Hong Kong, really. How would you respond, Mala, to these two questions?
Yes, that's a really very good question. So first is you are asking how the child would feel and whether it will affect his self-esteem when they're learning with children who seem more capable.
Yeah.
I think the teacher, as I said earlier, the teacher is so important. The teacher can be a good role model. And research has shown the teacher, if the teacher shows that she shuns a child, he or she shuns a child, it does filter to the children. So teachers can be very inclusive in their efforts and treat the child like, you know, we are treating everybody else. The biggest thing is if you make a child, oh, they are special needs, then it gets difficult. So the teacher has to set things going in a very calm and inclusive manner. And you can also look out for buddies in the class. There are some children who are, you know, they get along well with everyone and they show that they're okay with this child. That's a good buddy for this child with autism to have. So that's one thing that can help. The other thing is about competition. Yes, I think it's a bit like what Sarah said. Parents, you know, we want the best for our kids. And then when you see that the child has some difficulties, and then you think ahead and you worry. But in a preschool setting, it should be okay. You are not going to say that this child got 10 for all correct for spelling and that child got 2 for spelling. It shouldn't be that way in the first place, right?
Correct.
So we have to really think about what do we mean when we say education in the preschool context. What are we holding up for the children? And then things may get in place. I hope I've answered your question.
Absolutely. Thank you very much, Mala. Thanks a lot. So we have time for one more question before we go for our short survey. Sanjin, do you want to go ahead?
The last question, I'm not sure. I think each of you can respond if you want to. The question is about the I think I just read the question out. It says that I understood that being inclusive is to let everyone have an access to education, and that is to be included. Well, this means that we all welcome them regardless of their disability. So this is about our understanding of inclusiveness, I think. So any of you want to respond?
If I can start first, I'll just say that in reality, right, we all have special needs. It's just that some of us, we think we are normal, but in reality, some of us hide it very deep inside. And some others, some of us, we can, we are very self-aware and we know how to handle it. And we have loved ones who give us the support that we need. So in the same way, right, as teachers, as people working with these children, we have to give support. It's just every one of us has that. So I think this is the biggest myth, that they are different. What do we do specially for them? Yes, we do have some differentiation, but the commonality, look for the commonality. Yeah, thank you.
If I can add to that, I like to use the metaphor of a bridge. I think as educators, we spend a lot of time teaching children with additional needs how to cross that bridge into the mainstream world. What kind of social skills do you need? What can you do to exist in this mainstream world? But it's a falsehood. It should be a meeting in the middle. It's not how much support does this child with an additional need in my setting. It's also how can I help these children that are typically developing meet this child where they're at as well. We all need to come together at a central meeting point and go, okay, well, what skills actually do we need to make our space more accommodating? How can we meet you where you're at? If you're in the sandpit, can we meet you in the sandpit? If your perseveration is cars, how can we meet you at your cars? It's not about changing that child with an additional need to fit into what we perceive them as normal or typical. It's about finding where they're at and going with them on their journey.
Thanks. Yeah.
Great. Well, I'm just mindful of the time. Thanks so much for your responses. And then we would like to say special thanks to Miss Sophie Chua, who has been really helping us to put all of this together. She's wonderful. She has done an amazing job, like always. So thank you so much, Sophie, for making this happen. And thank you so much for the 5 speakers of the day. We have really learned a lot from you. And yeah, and we will hope to see you very soon in our next interconversation sessions. Sanjin, do you want to say something before we close?
Yeah, let's keep in touch, and we do look forward to seeing you next time.
Very good. Thank you so much, everyone. Take care and stay in touch.
Thank you. See you next time.
Please follow us on our different social media platforms that we are showing the links right here. We are on LinkedIn, WeChat, Instagram, and Facebook. So we really use this. You see, our friends are using the phones to do it. Very good, very good. I like this. So we really post a lot of our news there. So if you want to stay tuned with the work that we do over here at the Department of Early Childhood Education, so we really share a lot of our news and a lot of our information about the talks that we do and job advertisements and all kinds of things on all of these social media platforms. So thanks everyone again, and stay in touch. All right.
Thank you. Bye-bye.
Bye-bye everyone. Take care.